next awardee will be Dr. Julian M. Whitaker. Dr. Julian Whitaker is a graduate of Dartmouth College and Emory University Medical School. And after postgraduate training in surgery at Emory, Dr. Whitaker worked with nutritional medicine pioneer Nathan Pritikin. He then opened the Whitaker Wellness Institute in 1979, and to date, more than 50,000 patients have been treated at his Newport Beach, California clinic. He's the author of 14 books on nutrition and disease, including Reversing Heart Disease, Reversing Diabetes, Reversing Hypertension, and Dr. Whitaker's Guide to Natural Healing. His newsletter, Health and Healing, reaches more than 5 million households every month. Founder of the Freedom of Health Foundation, Dr. Whitaker has been a major force behind 5 of the 7 First Amendment victories over FDA censorship of health information. He's generously supported physicians who've been persecuted by state medical boards for innovative medical treatments, and he has successfully fought for the terminally ill to access experimental treatments. Dr. Julian Whitaker. Present him his award and his medallion. A few words, Dr. Whitaker.
Well, I'm very proud to receive this, and I again thank my good friend and colleague, Jonathan, for putting this program on. It's wonderful. I was interested in Joel Wallach's mention of the 15,000 or so individuals killed by just the natural use of traditional medicine. The number is actually close to 500,000 a year. Now, if we look at this, we saw this plane from Malaysia, 209 people. They died in an airline crash. We're not exactly sure why. Front page news for 30 days. Yet the hundreds of thousands of people that die from traditional medicine is never mentioned. I saw in the news once, a couple of days ago, that there was yet another shark attack in Northern California seas. And so we get a little upset and people don't go out in the swimming, but what would happen if the shark attacks on our beaches killed 200,000 people a year? How many people would go swimming? It is unbelievable to me that we can have this kind of mayhem exist in an area where we are trusting physicians who never really get examined for bad effects. A suicide by Robin Williams. What drug was he taking? What psychiatrist was giving it to him? If he was seeing a psychiatrist, he was getting a drug. So I researched this and talked to some people about it. Nothing has ever been mentioned. I had sent a private investigator down to Columbine School when those kids shot themselves and shot some other people. And I had a private investigator. It cost me $30,000 trying to find out what drug these kids were taking. And they were taking Luvox. I believe that was the drug. But the point is, the minute something happens with psychiatric drugs, it is shut down completely, right from the very beginning. I do believe that Big Pharma has attack teams that descend on the area every time there's a notable psychiatric suicide associated with, or maybe not associated with, just to cleanse the area. I think that the medical world is getting more dangerous, far more dangerous than it was 25 years ago. I think that it is systematized from the pharmaceutical industry and from the hospital industry, and that the simple exposure of their dangers is shut down. One of the things that I enjoy doing is simply telling people what to do to stay healthy. I heard recently that there was a person that many of the heart surgeons or surgeons in which the people die on the table or something, they'll come tell the grieving family, I want you to know I did everything I could. And then they should add to that, except just leave him alone. And the majority of those kinds of therapies, I have never recommended someone to have bypass surgery, ever. And I never will. Oh, wait, I did recommend one. This was about 15 years ago when he had unconditional pain. I'd kept him from bypass for about 10 years. But the point is, there is so much that can be done for all of these serious diseases prior to the use of any of this stuff, which is why I virtually never use it. Psychiatric drugs, it is so incredible. Now, I appreciate the war, Jonathan. This has been a wonderful experience. I enjoyed the comments of all the people. It's inspiring, and I am energized. Thank you, sir.
Dr. Julian M. Whitaker.